Hi, and welcome to another vlog on my journey of recovery from TLIF surgery, which I had on the 30th of May 2023. So a very exciting milestone today. Today is exactly 1 week post-surgery, and the time absolutely has flown by. In terms of what I wanted to cover today was, firstly, as always, just a little bit about how I'm feeling. And then secondly, talk a little bit more about the kind of physical activity protocol I've been prescribed as part of the recovery. So it's dawned upon me that I've been saying I'm feeling good quite a lot since I started posting the vlogs. But feeling good might mean different things to different people, so I wanted to give a bit more context. And the answer is it's of course all relative. So firstly, relative to how I was feeling prior to the surgery, there's actually quite a big difference. So, from talking about pain on a scale of 1 to 10, I would say prior to surgery, certain movements would push up to maybe an 8 or a 9 out of 10 in terms of pain. Whereas since the surgery, a lot of the pain is gone, and of course there is some local discomfort where the surgery was done and the incision site and so on, but at most it's maybe a 3 to 4. Clearly a big improvement there. Secondly, relative to how I thought I was going to be feeling at this point in time. So if you had to ask me prior to the surgery, where I thought I would be at this point, I would have told you firstly in a fair bit of pain, and secondly not able to do an awful lot for myself. The truth is I'm actually in a lot less pain than I thought I was going to be, and there isn't an awful lot that I'm not able to do for myself. I mean, of course I've got to be careful, but I can do everything from have a shower, to get dressed, to make myself some food. On balance, I'm much further ahead than where I thought I was going to be. So between those two factors, I'm feeling really positive about where I am, and hence why you'll hear me saying I'm feeling really good quite a lot. Now, what I must say is that I wake up this morning feeling a little bit sore, and it was sore on the kind of left-hand side in my leg. Basically, so essentially everything from my glute to my hip flexors to my quad to my calf, everything was sore, and it was as a direct result, I think, of a little bit of overuse yesterday when I pushed a bit and walked about 2.5 kilometers. Now, what's important to remember is that all these muscles were in spasm probably for about a month. Because of the nerve compression that was there before, and muscles start to atrophy quite quickly, and therefore it's going to take some time to kind of get the strength back. So it's not something I'm worried about, but just something to be aware of, in case you experience something similar post your surgery. Wanted to show a couple of artifacts. So the first is my brace. So this is a brace that was prescribed by my doctor, a fairly fancy looking thing, as you can see. So it has 3 different straps to make sure it sits quite tightly around the waist, and it has some supporting battens in the back here, just to make sure that the back is fully supported. So I've been told I have to wear the brace for the first six weeks at least. Of course I can take it off when I sleep and when I shower, but aside from that, it has to be worn. It has pros and cons. So the pro being that your back is nice and supported, and therefore the risk of injury is a fair bit lower whilst wearing the brace. The con is that, of course, it makes the core muscles a little bit lazy. So as a consequence, when you get to the 6-week mark, you have to literally wean yourself off it slowly to make sure that you kind of don't injure yourself as a consequence of a bit of core weakness and the core muscles not firing. The second thing you'll need would be a pair of barbecue or bride tongs, as we call them here in South Africa. And the reason you'll need these is because they tell you that after surgery you aren't allowed to bend, lift or twist. Now, with that said, if you want to get anything off the floor, for example, or pick up a pair of shoes to put those on to go walking, you will need a pair of these in order to be able to do that. So if you are going to surgery shortly, do make sure that you invest in a pair of barbecue or bride tongs. Moving on to exercise, I guess the kind of first and most important thing is they do encourage you to walk as much as possible within reason. What I mean by within reason, of course, you can't push too much, otherwise you'll just end up doing what I did yesterday, which is getting yourself a little bit stiff and sore. So building that up over time. But as I said, I'm fairly impressed with the fact that I can manage somewhere between 2 and 2.5 Ks already, which is kind of more or less what I was doing on an average day prior to the injury and having surgery anyway. So very positive, but we'll look to build that up even more over the next 6 weeks. And then I've been given some very specific rehab exercises to do as well. So, starting with some very basic core activation exercises, and then various leg raises. So firstly straight leg raises to the front, obviously to get the core muscles and the hip flexors to fire, and then also some sideways leg raises as well to get the glutes to fire. And aside from that, I'm not allowed to do anything else at this stage. I have my 2-week checkup during which I'll see both the doctor about the incision as well as with the physio to kind of see my where I'm at that point and assess my progress. And because I was fairly fit prior to having the surgery, I probably will see if there is a possibility of me incorporating some additional exercises into my rehab, because I do feel like I'm capable of doing a bit more than the exercises they gave me. So anyway, so that's it. The end of the first week, as I say, very exciting, and I'm very grateful for how I'm feeling at this stage. I think what I'll do is I'll start spacing the updates a little bit further apart from now on, because I don't think things are going to change that much in a day or two moving forward. So look out for the next post maybe in 3 or 4 days time. And thank you for watching. By the way, if you do find these useful, please click on the subscribe button and activate notifications, and then you'll be notified automatically every time I post a new update. Thanks.